Nigeria is heading towards another crucial election year, and as always, health security remains an important issue for the country. The recent COVID-19 pandemic and infectious disease outbreaks in different parts of the country have once again highlighted the importance of epidemic preparedness and response for any nation. Join us as we hear from Nigerians on the importance of funding for epidemic preparedness and response, and their hopes for a healthier and more secure nation.
From a scale of 1 to 10, should I rate them maybe 8?
They tried, but not as expected. I'll give them 5.
Personally, I feel the response of the government was below average.
Let me give them 7 over 10.
Well, 3 over 10.
I would give them 8.
If I'm being honest, the government is not doing very well, actually. I would give them like 5 over 10.
I don't think they don't have plan for the masses. When they have headache, they will get abroad. I will be here drinking agbo, taking agbo for me to common malaria. No good hospital.
I want to say our government is doing well on their home part within their capacity.
I don't think so. If you want to compare based on what happened a few years ago, this COVID-19, people suffer. A lot of people that died was as a result of lack of medical care.
I don't think they've put enough structures on ground to prevent further or future occurrence of such breakout.
The government responded very well to the COVID-19, and their response really helped to even curb it.
Their response were very active. As per the COVID-19, they were able to tackle the safeguard measures as educating people to put on their face masks, wash their hands regularly, and then avoid, contact with people. So they were very active.
No, actually, in my area in Nigerian, they actually had no facility at all. For even COVID patients, they had no facilities. They are not actually putting enough structural amenities in places for us, actually.
The Commissioner for Health, we have tried to put many structures. There are many structures. That's why they think couldn't get Nigeria more higher than other European countries or nearby countries, African countries.
Enough structure in place. I don't think we put enough. The government, they try to put, let me say little, but not enough. But when I say enough, that means it will be okay to at least cater for more than 60%. So I will not say enough.
I think it's very important because it's anything you do in terms of preparation, it's about the money. Like in terms of preparing doctors for epidemics, and then maybe putting aside some environments that will be good for people. I think it's about the funding. Funding is very important.
We tend to hear about so much funds that has been given to the government at the national level, and it does not flow down to the local government level. We just hear big figures being mentioned, and you see people dying even at the grassroots, and nothing is being done about it.
It's very important actually, because we don't know what disease is coming out next. We need to be fully prepared in terms of, okay, we need money for this, we need money for that. At least even gloves should be free. So we need money for the next coming pandemic.
We should go back to the grassroots, from the local government, from the rural areas, where everybody will access medical. It shouldn't be something for where everybody will be going to abroad. No.
Funding is very important, and if we are saying we've marked a particular amount, we should ensure that money is utilized for that purpose.
I believe that our government by now they have already know that there are many diseases that have not come that are yet to come. So I know they have put in many things, there are some resources behind, so that when the thing comes, they will just fight it.
We should have the personnel trained for it, we should have the equipment, and we should have medications ready for it.
I think they should prioritize immunization from time to time to prepare to help our immunity fight any disease that is coming.
What happened during the COVID time showed us a whole lot in our health facilities, that there were no proper health care. The facilities were not able to carry the people, so there was a decay kind of in the health sector. They were rushing to get this. All of these things would have been done if the funding was available at the time they needed it. They would have arranged all of this, get quality health facilities that would tackle this, so it wouldn't be like a surprise to them when such things occur next time.
All the hospitals, government hospitals, privatize, give it to private people, so that they will handle it. They handle it in a more proactive way.
If they can try their best to fund the medical team, and they should go for different trainings and do different research as regards epidemics and diseases.
Sensitizing people is very, very important, because if you are not informed, you will be deformed. So information is a key. Information saves lives, information saves one from a lot of casualty.
Let them equip our hospitals, understand, so that whenever we go there, we can see a good facilities. They can attend to us very proper.
Government should put much more resources into doctors training, and then other medical personnel, nurses, and then lab technicians and so, because when all these things happen, these are the people that are at the forefront of the disease, of treating people and getting people okay.
More funds should be pumped into the Ministry of Health, and then various Center for Disease Control.
Awareness, they're making people to know that such case can come.
They should fund the medical sector more, because when the medical personnel feel satisfied, feel safe, they'll be able to stand and tackle whatever it is that is coming. But to be out of place if the medical personnel are not properly equipped.
It will, because we want to vote. Because if you get your democracy, especially the leader who you bring, play a very key role. Because if you bring the wrong leader, it will affect. So I will come out, I will mobilize.
Some politicians particular that I need are stored resources during that time. I need to give it to the people. People like that, of course, when I'm going to vote, it will impact my decision, because I will see them as selfish people and I will look out for other alternatives.
The preparation is very important. So that's why the next government that is going to come, I know that because we are talking about someone that has the capacity, the intelligence, the ability to be able to put on structure that will tackle any such epidemics around the nation.
They actually did some things that made us feel that they were not sincere. There was no transparency in the things they were doing. So for me, I wouldn't want to vote for such persons, such people anymore, because I didn't see transparency in what they said.
Actually, I think I'm going to vote, and I'm not sure it's going to impact me as a citizen, but I'm sure it will impact others, because they'll be wondering, is it the government that is not helping me? That made COVID killed my family member, that will now vote for? No, I won't. So to me, it won't impact me, but to other fellow citizens, it might actually.
I will take any government that responds promptly as being serious and as taking the health of the citizens very important.
It is one of the important things to elect a leader. If a leader promises us that something like that will not happen, and if something like that happens, he will fight it, it's good for me. I will be able to vote for that person.
As we head towards the 2023 elections, Nigerians are calling on their leaders to prioritize health security. Adequate funding for epidemic preparedness and response, as well as the overall health infrastructure, is crucial for the nation's well-being. We hope that those vying for public office listen to the voices of their constituents and make health security a top priority.